Yeah, good evening, everyone. Welcome to Module 13B. In our previous module, we talked about uh, personal care, and we discussed what we'll be talking about generally in the whole of Module 13. So, this is Module 13B. Here, we'll be discussing about infection control. Infection control. We've talked about something similar to this before when we were talking about prevention from danger, how to prevent infection. So, now without wasting much time, you know what infection is? Infection are harms caused by what? Infectious agents into the host body. I want to control how you can control, regulate, reduce the amount of disease causing microorganisms within the region or within the body of the host. So that was much time. I'll move to the introduction. So, the introduction to infection control. Now, providing personal care begins with the home health care aid and the ability to what, maintain proper infection control. As we discussed previously, that hand washing is one of the cheapest yet a very effective way of what, reducing or preventing the spread of infectious agents. So hand washing here is the number one way to prevent the spread of infectious agents. And what are infectious agents? We discussed before also that infectious agents, they are anything that can cause disease, such as maybe bacteria, such as viruses, such as parasites. And it is the easiest way and the most effective way for a home health care aid to stop the chain of infection. Now, the first, or let's say the core value of a personal care aid or a home health aid is what? Prevention of infection or infection control. Now, if we don't prevent infection or we don't control them, we discover that a lot of people all over the world, especially in underdeveloped countries or developing countries, die of infection, bacterial infection, viral infection, uh, parasites. We know how. Thank you for the improvements in world of medicine. Malaria, when it used to be what it used to be, it can be very deadly. So imagine living with constantly we interact with infection because there's something called a chain of infection like the triangle, infection triangle. We have the host, we have the agent and the environment. We call the host agent environment in the epidemiology triad of what of infection. So we are the host, the infection are they are agents of infection, the infectious agents. Then we have an environment. So we constantly live in an environment where we have this interaction with what? With all these properties, these particles. In as much as there's an interaction with them, disease will always come. So the only way in which we can prevent the spread and our vulnerability to them is what? Is to control their spread and reduce the amount in which they are produced in our environment. So, as home health aid, the our patient's care begins with or personal care for the patient definitely begins on for ourselves begins with our ability to what? Maintain proper infection control. So let's look at the chain of infection. And the chain of infection is how infection is transmitted. Now, infection has a pathway. Understand this. If at any point a chain is broken, the chain is broken at any region, infection may not occur. Then, as much as the chain is complete, infection there will always be infection. And there are five parts of what infection chain or chain of infection. Five main parts. The reservoir, who carries the uh, the the infective agent. Now, the portal of exit. How does this infection leaves the body of a reservoir, the mode of transmission, what mode, in what form, what portal will it pass to be transmitted? The portal of entry, how does it enter into the host? That is the susceptible host here, and then we have the susceptible host. So we'll keep this, we'll break this down one by one into a simpler version for understanding. And the first is what the reservoir. A reservoir is same as what? A host. So the reservoir includes both human, both animals, and even the environments, maybe water, maybe the soil. This is the person, the animal, the place where the infectious agent lives and grows. So it is that place where those infection agents lives and grows in. Now, what is the portal of exit? The portal of exit is how the infection agent leaves the host. So how does it leave the host? So portal of exit can include respiratory system, urine, feces, and even the skin. And for example, if a person has influenza, that's flu, they can transmit them, they can transmit the virus to another person when they sneeze. So if a person who has hepatitis B or HIV can transmit the virus through their blood or body secretions. So this is what the mode of exit. Now, mode of transmission. This is how an infectious agent is transmitted or given to a person. And there are several modes of transmission. We have direct contact, we have droplets, we have airborne, we have vehicles, we have vectors. So these are modes of how are they moved? How are they moved from one place to the other? Now, again, we have direct transmission. We have direct transmission like infection agents are transferred or transmitted either through direct contact with a reservoir as a host or by droplet transmission. Or you also have direct contact. You have direct transmission. That means they're transmitted either through direct contact with a reservoir or by droplet transmission. So by direct contact now, transmission this way occurs through direct skin to skin contact or sexual intercourse or exchange of body fluids, maybe while they are kissing. So mononucleosis, hepatitis B, and HIV are spread through or via direct contact. Again, droplets. Droplets, this transmission it occurs when droplets from maybe sneezing, coughing, or talking are spread a few feet into another person's or into another person's environment or onto another person. But when you sneeze, now those sneezes are what droplet drop on either the skin of the person or the handkerchief or the clothes of the person. So like things like pertussis or meningococcal infections, they are spread through droplets. Even tuberculosis too, they are spread through droplets. So now we'll go to the indirect transmission. Indirect transmission, we have the direct transmission by contact or by droplets. Then we have the indirect transmission, which is by airborne, by vehicles, or by vectors. Now, airborne, here we have transmission in a way whereby droplets, for them to be direct contact, it must contact with the skin. But in this case, the droplets are suspended in the air. So eventually, because of air moving around, so the air will carry them as currents, because it's air currents. So those currents now will be inhaled by the susceptible host. So, for example, measles is an example of something that can be spread by airborne transmission. So, when these droplets are expired in the air or they are suspended in the air, they eventually contaminate the host. Then vehicles, like transmission by vehicles occur through blood, water, food, and fomites, like objects such as surgical instruments used or used tissues and even dirty beddings. They are very good. So surgical instruments can transfer disease or infection to one other person, one or two people, like between one or two people. For example, now hepatitis A is transmitted through a vehicle and it is carried through food or water that has been contaminated. Botulism is spread via a vehicle as the bacteria is found in contaminated handfuls. So these are they are not necessarily transferred by the infective agent but by a substance capable of moving the bacteria or whatever it is and depositing it in what in another location. So, for example, now when food or water is contaminated with hepatitis A virus and you consume, so that's like a vehicle for what? For the hepatitis A virus to what? Infiltrate or infect the person. Then vectors. Vectors here we have transmission via vectors occur through ticks, through mosquitoes, through fleas. Now, as malaria is transmitted through mosquitoes, a vector. Lyme disease is transmitted through ticks, also a vector. Now, how do we differentiate vector from vehicle? After we know what airborne is. So the confusion we may have at this point is how to differentiate vehicles from vectors. Vectors are living organisms that invertebrates that moves or transfer diseases. While vehicles are most times non-living things transferring what a disease concern like fomites now. Maybe like fomites, fomites can also have to do with contact though. But when an infectious process is especially food or water that is contaminated, hope we get that. Now moving to another one. Now we have the portal of entry. We talked about the what? The transmission. Now we're moving to the portal of entry. And portal of entry is how the infectious agent enters the host or the person, the infected person. How will he enter the person to be infected? The portal of entry is often the same as the portal of exit. For example, infectious exits an infected person's respiratory tract and enters another person's respiratory tract. So, how does it leave and how does it enter? Most times they are same, but I can't say they are exhausted because it may not always be like that. Anyway, so the susceptible host is the person or animal who contracts the infectious disease. The very young and elderly are very much at risk of contracting an infection. Why? Because the immune system is not fully developed in a young child. As we age, our immune system begins to what? Diminish. So they're no longer effective as it was when we were young. The people who are already sick or immunocompromised, like those who have the immune system that is unable to fight infection, they are at high hosts. So home health aides or personal care aides have an important role in breaking the chain of infection by what? Properly washing the hands, wearing gloves when coming into or coming in contact with body fluids like gloves. So properly cleaning and sanitizing the equipment and the home generally and also what help stop the chain of infection. So other ways that home health aides or personal care aides can help break the chain of infection include teaching the patient to sneeze or cough into a tissue when washing and even when washing and then washing their hand. So when you just cough into the air, cough into a tissue and then wash your hand after that. Then you teach the patient to practice proper hand hygiene before meals, washing their hand before meals, after using the bathroom, and anytime their hands come in contact with any dirt when the hand is spoiled or soiled. By this, the home health aid or personal care can also help to stop the chain of infection. So we should also teach patients to place used sharps from needles in designated sharp containers. Used needles should never be disposed of in the garbage or left out. Why? Because as this needle can prick another person's, it can transfer infections if the needle has been infected, of course. Even if the owner of the needle was not infected, and the needle is exposed, bacteria may grow around the sharp end, and when they puncture someone, the person become was infected with what, a bacteria or an infection. So this puts other people at risk for contracting an infectious disease. The disposal of sharps containers will vary depending on where the home health aid or the personal care aides lives. And this is an important issue that should be discussed with a supervisor. So washing hands or hand washing is the number one way to prevent the spread of infection. Hands should be washed when they are visibly dirty or soiled with blood, body fluids, and secretions. Hands should also be washed before and after eating and using the restroom. Hands should be washed when arriving at or before leaving the patient's home. Wash your hands before putting on gloves and after removing them. Wash your hands before and after all patient contact, including contact with the patient's belongings. Then, when home health aides or personal care aides care for a patient, they should always practice proper hand hygiene and use personal protective equipment, that's PPE. So this includes use of gloves, and those gloves will be worn anytime in the home health aid. Anytime the home health aid or personal care aid will come into contact with what body fluids such as urine, feces, or vomit. Gloves should also always be changed when they are visibly soiled or they are ripped off. So a home health aid or personal care aid have an important role in breaking the chain of infection. And we talked about that. Okay, sorry, I think it's a back sheet. So this is an example of the number one. A is example of what vehicle, while B is an example of what vector. So how do we wash your hand? What are the procedures for hand washing? A lot of us just pour water on your hand and do like this and like and we go. No, there's a procedure for hand washing. And the first thing is to ensure that all what you need for hand washing is on the sink, like your soap, your paper towels, and even the cotton towel if paper towels are unavailable. Be sure that the soap is within arm's length so you do not have to touch the sink to reach it. Now, roll your sleeves up, remove your watch and your jewelry. This item may hold bacteria. So stand away from the sink. Do not let your hands or body or your uniform to touch the sink at any time as it is contaminated. So wet your hands and your wrists thoroughly under warm running water. Then apply soap to your hands. You can picture this as you are talking. Apply soap to your hands. Keep your hands and forearms lower than your elbow. And this is your hand. You don't wash like this. You wash like your elbows up. You stick and then wash that way. Then if you allow water to run from your hands to your arm, you will contaminate those areas. So rub your hands together and lather all the surface of your wrists, then your fingers, your hands, clean your nails. By rubbing them with the palm of order, you clean your nails like this. Then pay attention to your knuckles and the sides of your fingers, all the sides of your fingers, all this place. You ensure that your fingers are washed, including your thumbs, your little finger. This can simply be missed. So be specific about your thumb. You can intentionally wash your thumb like this, and your little finger, you wash them, and even by rubbing, use your rubbing motion to ensure all surfaces of your hands are washed. So use friction by rubbing your hands together for at least like 20 seconds. So this is appropriate length time to cleanse your hand according to the what CDC current guideline. And like CDC means the Center for Disease Control. So humming or singing the Happy Birthday song twice from beginning to end is one way you can time 10 seconds. So rinse all surface of your forearms, your wrists, your hands, and your fingers. Ensuring that you keep your hands below your elbows and allow the water to rinse off, starting from your forearm to your wrist down to your fingers. This prevents water from your hands to run into your forearm and contaminating the surfaces. To be sure not to touch the sink while washing your hands, and also use a clean and dry towel to clean cotton towel or cotton towel to dry your hands. And dry your hands starting with your fingers. You can move to your wrist and to your forearm. Dispose the paper towel in a garbage can without touching the garbage can or other surfaces. With a clean and dry paper towel, turn off the faucet. Faucets are dirty already, so you can't take the risk of contaminating your hands if you use your hands and not a paper towel to turn off the faucet. So use a clean and dry paper towel rather than the wet one. Use the wet one used, or dry your you should use a different one to clean the stuff rather than the wet one you use by your hand. So this prevent bacteria and other pathogens from transferring into the paper towel and into your hands. Then dispose of the paper towel. You can now apply a cream or a lotion to your hands as needed to prevent your skin from cracking or drying. Cracked or dry skin leads to skin breakdown. And skin breakdown leads to what? Open area for bacteria to enter to infiltrate the skin, or some pathogens to easily enter into the skin. So use of alcohol-based hand sanitizers. So how do we use alcohol-based hand sanitizers? In the case where no running water is available, you may use an alcohol-based cleanser that contains at least 60% alcohol. Apply a generous amount of alcohol-based sanitizer to the palm of one hand. Rub the hands together, covering all surface of your hand and fingers. Use friction as you would when washing your hands with soap and water by rubbing the hand surface together. Interlace your fingers like this and rub your hands together to ensure all the surface of your hands have been covered with the cleanser. Rub the palm of one hand over the back of the other. Then rub the thumb of the other hand on the palm of the other, and do the same with your thumb as well and the other fingers. So you rub the fingers of one hand into the palm of the other to clean nail beds. Then repeat to clean the nail bed of the other hand too. Then you can rub hands together until the product has completely dried. Remember, hand sanitizers are not as effective as well removing germs as washing your hands. So you should use soap and water when hands are visibly soiled or visibly dirty. Now we want to move to how we remove gloves. Now we talk about using hand gloves, washing your hand, and using hand gloves when you attend to a patient. So how do we remove hand gloves? So how do we done as putting and removing what? Hand gloves. The gloves are to be used anytime you will come into contact with body fluids or blood, including vomit, urine, feces, or saliva. Now, gloves should also be worn when providing a bath, a mouth care, or when shaving a patient, and when disposing the soiled linen, dressing, or bed pads. The gloves should be worn anytime you have cuts or open areas on your hands in which bacteria could enter into your skin. If allergic to latex, home health aides or personal care aides should inform the employer so that appropriate latex-free gloves can be provided to them. The gloves are not only to be they are only to be used once, not to be used twice. Never wash or reuse them. Anytime a glove becomes soiled, torn, or wet, replace them with new ones immediately. Remember to perform hand hygiene prior to and after removing your gloves. So joining that's applying gloves. Wash your hand as outlined in the hand washing procedure. And the right, and if right-handed, pick one glove with your right hand. Position the gloves at the thumb side of the gloves align with your thumb on your left hand, and then you slide the glove onto your left hand. Quickly, I could just give after washing your hand, for example, I have a glove with me here, so I could just give us a practical. So for example, this is a glove here. Since I'm a right-handed person now, I put on the glove with my right hand and position the glove at the thumb side of the glove align with the thumb on my left hand side, and what you slide glove to your left hand. So, for example, now let me expose this well. This is a glove, and this is what the left. This is the left side of the glove. So what do? This is the thumb. you slide, you see, just like this. So if you are a right hand person and you start with your right hand, you pick with your right hand, you position the glove at the thumb side of the glove, align with your thumb on your left hand, and you slide glove into your left hand. Then you pick the second, which is for the right hand, and you do the same thing. So you make sure that your hand doesn't come down below your wrist, be above your wrist, so as to ensure that you're not touching any contaminated surfaces. It should be above your wrist. Then you look for it, use the thumb again. So make sure that the thumb aligns with your thumb. Then what? You going again. So this is just a simple way of wearing the glove. So with your glove hand, you can take the second glove and slide the hand in. So be sure that you replace any glove that appears to be soiled or ripped or torn. So how do we remove gloves? Beautiful. So I think I was fast enough to remove this glove. So let me put it on back so that we'll use this to explain how to remove gloves. So removing gloves, now when removing gloves, touch only the outside. Now this is a glove, this is one. How to remove this glove, do not touch your wrist or your skin with a contaminated glove. Now I assume that I've used this glove and this glove is contaminated. I don't touch my skin with it because why? The infections here are being transferred to my skin. So you pick it what? From the outside. Now this is the outside part of it. You pick from the outside. So grab the outside surface of the glove below the thumb, like this. Slide your thumb under the cuff off. Do not touch the skin under your gloves. Grab the glove and peel the glove off so that what? It is inside out. Inside out. Now, this time the contamination can touch this. So keep the slided glove what? In your glove hand, like this. Then with your glove hand, you put two fingers underneath the cuff, not on. If I put it on like this is wrong because with my ungloved hand, I have totally packed in front of this palm. What do? I put two fingers, we try to infiltrate like this. So two fingers under the uncuffed hand, because you believe that this inner surface is not contaminated. So it's not touching your palm. When you hold it that way, not touch the outside of the glove again. Then what? You peel off in the same direction towards the finger. And when it's done like this part is not contaminated, it is inside out. So the very surface is folded inside rather than on the outside. So this prevents the risking contaminating your hands with what? Soiled gloves. Then you discard the glove and wash your hand as outlined in the hand washing procedure. So this is the end of this module. I hope you understand everything that was taught here. Just a brief recap on what we discussed so far in this module. We talked about what? Infection control, and we've introduced to what infection is. And we talked about the chain of infection, where we talk about the reservoir, the portal of exit, then the mode of transmission, and we talked about the direct transmission and the indirect transmission. And direct transmission can be through droplets or through contact. Then indirect can be through vectors or through vehicles. Then we also have the portal of entry, starting from the what? After the transmission, right, portal of entry, and we have finally the susceptible host, which is all five together. The reservoir, portal of exit, mode of transmission, portal of entry, and susceptible host. Then we talked about procedure for hand washing. How do you wash your hand? As we know that the core or the basic rule of prevention of the spread of disease or germs is hand washing. So how does it work? How is this working? So we talked and we discussed that here in the procedure for hand washing. Then we talked about how to also use sanitizers or alcohol based in place of what? When there's no running water. But remember that washing your hand is more effective than what? Than hand sanitizer. Then finally we discussed about procedure for donning and what? Removing gloves. how do you wear the gloves and how do you remove the gloves. Now, this is just for a normal gloves. There's a different procedure for wearing sterile gloves. I wish you check that out. You are wearing a sterile glove, but then we're not having any contact that will be needing a sterile glove. So we just use a clean glove, normal glove. So, and we've been able to explain how to wear the gloves and how to remove them from our hands. Thank you very much for your time and your understanding. Have a wonderful evening.